My name is Dr. Ndiviwe Mpotulo. Today we are going to be speaking about TB LAM test. The World Health Organization and TB strategy prioritizes the diagnosis of TB. This includes diagnosis of TB in smear-negative patient, which is often the case in patients who are HIV co-infected and in young patients. The urine TB LAM test can be used in inpatient and outpatient settings. In the inpatient settings, this test can be used irrespective of whether the patient has got TB symptoms or not. Can be used irrespective of the CD4 count, can be used irrespective of if the patient has or does not have advanced HIV disease. For outpatient use, the urine TB LAM test can be used in patients with signs and symptoms of pulmonary TB or extrapulmonary TB with CD4 count of 200 or less, in patients with advanced HIV disease, in patients who are seriously ill. The determined TB LAM test is an immunoassay for the detection of LAM antigen of Mycobacterium in human urine as an aid in the diagnosis of active mycobacterial infection in people living with HIV and with active tuberculosis. Urine is an ideal sample as it is not specific to the location of the infection, it is easily available, it does not produce hazardous aerosols. As a result, it poses a lower biohazard and infection risk. I will now cover the contents of the test pack and material that is required for testing. 1. You have a 25 TB LAM AG tests and 5 cards, each holding 5 test strips. Number 2, you've got TB LAM AG reference card. Number 3, you've got 1 TB LAM AG instruction for use form. You've got 60 microliter pipette and 60 microliter tubes. So they come as separate package with the test kit but are not found in the testing kit. These can be replaced by disposable pipettes of similar volumes if you do not have the above mentioned. There are materials that are required but are not provided in the kit. At all times in the clinical settings due to COVID-19, we should be wearing our masks. 1, you need a timer. 2, you need gloves. 3, you need a blotting paper. 4, you need a sharps container. 5, you need a pen and sharp permanent marker. 6, you need a biohazard disposable bag. 7, you need a TB identification register. You also require a patient clinical record or ART stationery. The TB LAM antigen test card have specific storage requirements to maintain quality and reliability. These must be stored between 2 to 30 degrees Celsius until the expiration date. Please do not use the kit components beyond the expiry date, except for the reference card, which can be reused. Do not use the tests that have become wet or if the packaging has been damaged. The storage conditions and room temperature must be checked daily. In hot areas, the test may be stored in refrigerator without freezing it. Immediately reseal all untested tests in the foil pouch containing the desiccant by pressing seal from the end to close. Specimen collection and handling. Ensure adherence to infection prevention and control measures. Collect the urine specimen according to the guidelines. Clear instructions should be provided to the patient on the collection of urine. Advise the patient to clean the urogenital area prior to the collection of urine specimen to avoid contamination. Ask the patient to collect midstream urine by allowing the first bit of urine to pass before collecting the urine in a sterile container that has been provided to the patient. The patient should wipe any spoilage on the outside of the container. The deal will be to collect a first or early morning specimen, but it is not essential. Early morning urine specimen increases the yield considerably. In cases where the patient cannot void urine after several attempts, an early morning specimen can be collected. The urine samples must be tested within 8 hours of collecting the specimen, provided they are kept at room temperature at all times. Treat all urine specimens and materials contaminated with urine as potentially infectious and follow basic universal precautions. 1. Wear gloves when handling the specimen and test kit material. 2. Use appropriate methods for pipetting when drawing urine specimen for testing. Do not use your mouth. After the test, discard the urine and dispose of the test strip, pipette, and gloves in a biohazard medical waste bin for disposal in accordance with hazardous waste disposal guidelines. If there are delays in running the test, the same may be stored 2 to 8 degrees Celsius and used within 3 days of collection. Test station has now been prepared and we have ensured that all materials are available as neatly set out. Check the condition of the test kit and strips. Record the kit lot number in the remarks column of the TB ID register. Confirm the expiry date and storage conditions of the kit. So the next step is that you remove one strip from the 5 test card by bending and tearing at the perforation. Start the removal of the test units from the right side of the test card to preserve the kit lot number which appears on the left side of the test card. Peel off the protective foil cover from the test and set it aside. Please note that once the protective foil has been removed, the assay should be initiated within 2 hours. Using the already calibrated pipette, you apply 60 microliters of sample urine or 2 drops of urine. These you apply to the sample pad. Now, the sample pad is a white pad that is marked by the arrow symbols. Here are the arrow symbols. Set the timer immediately after dropping the urine in the pad and wait a minimum of 25 minutes to read the result. Interpretation of results and quality control. After 25 minutes of incubation, your results are ready to be interpreted. Results are stable for up to 35 minutes after sample application. Do not read beyond 35 minutes to avoid reading incorrect results. To read the result, visualize the strip under standard indoor lighting conditions or in the shade. Do not visualize the strip under direct sunlight. Use the reference card that is provided in the kit to assist with reading and interpretation of the results by holding it alongside the patient window. The appearance of 2 purple or gray bars in both the control window, which is level to control, and the patient window which is labeled patient, indicates that the TB LAM is positive. The test result is positive even if the patient bar appears lighter or darker than the control bar. This means that so long as there is a control line present, it is a valid test even if control line is lighter than the patient line. There is no correlation between the control line and patient line. The appearance of one purple or gray bar in the control window of the strip, which is labeled control, and no purple or gray bar in the patient window of the strip, that is labeled patient, indicates that the TB LAM result is negative. If the control bar does not turn purple or gray by assay completion, the test result is invalid and the sample should be retested. If one purple or gray bar appears in the control window of the strip with unclear or incomplete purple or gray bar in the patient window of the strip, the TB LAM result is indefinite. The test should be repeated. When the color intensity of the bar in the patient window is lower than colored bars in the positive range or on the reference scale card, the TB LAM result is indefinite. The test should be repeated. Alternatively, ask the patient to collect an early morning urine specimen for retesting the following day. It is important to note here that a negative test does not rule out TB. Collect a sputum specimen on all patients for a gene expect test irrespective of the TB LAM test result. If you suspect extrapulmonary TB, collect a relevant specimen. This is because this test will not provide information about rifampicin susceptibility. It is used as an opt-in test in people living with HIV. Where and how to record in the TB Identification Register, version 2020. A. Record the date of the urine LAM specimen collection in the top row and record the positive or negative results in the bottom row under the ULAM test block. B. Record kit lot number and the expiry date in the remarks column of the register. It is important that the expiry date is written in full and the kit lot number is legible. This is necessary for data monitoring and future reference when the test is required.